Hi, this presentation is on implant surgery. So, dental implants are basically an artificial root that is implanted into the jawbone to fix any edentulous areas of the mouth. Typically, it's used to enhance prosthetic dental care. So, it provides support for crowns, fixed bridges, and removable dentures. It also improves aesthetic outcomes for patients, as well as improved functioning, making it easier for them to chew and speak.
And how the procedure is performed. There are four phases, and first phase is team planning and 3D images. And before implant surgery begins, dental teams like the dentist, surgeon, dental hygienist, and work together. A 3D scan called CBCT is taken to show exact shape and thickness of the jawbone. And the second phase is opening the sides. Once the area is completely numb, the surgeon makes a small cut in the gum and gently lifts the tissue to expose the jawbone. And phase three is creating the space safely. The implant is carefully placed into the peripheral bone. A tight fit at this stage is called primary stability. There are two approaches in one stage procedure. Part of implant remains visible through the gum and no second surgery is needed. And the two-stage procedure, the implant is covered by the gum and a small second surgery is done later to uncover it. And about the bone healing, the most important healing process is called osteointegration. That's when a jawbone grows tight around the implants and locks it into the place. And about the biology of the tissue healing around the implant totally different from the normal tooth because we don't have because an implant doesn't have the soft cushions and ligaments around that, and it's important to know how long does it need to for the healing. It's around the 3 to 6 months. And there is another things that called building extra bone or CBR, a bone graft barrier member used in the bone graft and to help to allow the bone to grow and create a stable foundations around that. And I added two radiograph images as well. The first one showed the alveolar bone loss around the dental implant. And in the recall visit, and the B is a graft and membrane placement prior to stunning and radiograph taken 10 months following surgery. And it show the bone fills as well. And about the suture and dressing.
So there is different materials that can be used as sutures. So the oral surgeon will need to use sutures to stabilize the flaps after the surgery to put the gums back together. There's different materials they can use to do this. It can be either absorbable or non-absorbable materials. The normally use absorbable materials because it's easier for the body to naturally break them down, and it doesn't require professional removal most of the time. In terms of the technique used, they either use interrupted or continuous. It depends on the length of the incision typically. And then in terms of dressings, they don't normally use periopacks anymore in oral surgery, but they can still use them. It does help protect the wound from injuries or irritations. It also prevents like too much bleeding. It keeps pressure on the wound. It also lets it keep the area clean, and it can also add comfort for the patient.
And about the post-surgical instructions, after surgery, a small amount of the bleeding is normal. The patient should bite on gauze and avoid using straws, smoking, or spitting. Swelling is most common during the first few days. Ice pack can help reduce swelling. The surgical area shouldn't be brushed or floss for the first day. After that, gentle rinsing and careful cleaning are recommended. Any prescriptions, medication should be taken as directed, like the antibiotic or any painkiller, and any pre-scrub, rinse, or mouthwash if provided. And about the diet, any sticky food, any for the first week, patients should eat soft food such as the yogurt, egg, smoothie, and soft food. And rest is important, and heavy exercise should be avoided for at least 2 days. Smoking and alcohol should be avoided because they can slow healing, increase the infection risk, and raise the chance of the implant failure as well.
So the different outcomes from implant surgery, the main outcome we're looking for is peri-implant health. That's basically a lack of inflammation, no bone loss more than 0.2 millimeters after the first year. You want to see no swelling, no redness, no bleeding, no pus. And this is good for indicating long-term positive prognosis and long-term stability of the dental implant. But there is some adverse conditions that can come. So one of them is implant mucositis, which is basically peri-implant gingivitis. This is a condition that is induced by plaque typically. It is a plaque-induced inflammation. It's when plaque gets around the implant tissues, but there is no loss of supporting bone. You will see signs of inflammation, so that redness, the swelling, bleeding, or pus on gentle probing. There's also usually increased probing depths that are increased from when they first installed the prosthetic. So like the crown, if the probing is deeper than that baseline, it's a sign that there could be some inflammation going on. And this condition can lead to peri-implantitis, which is a much more serious condition. Peri-implantitis is basically peri-implant periodontitis. This means that you have all the inflammation, but there's also progressive bone loss. This is diagnosed through clinical signs of inflammation. You can see radiographic bone loss around the implant. Sometimes this looks like wedge shapes or hollowed out areas around the implant. It has been found in some studies that this can be actually more destructive and can progress at a faster rate than non-implant periodontitis. So these things are what you look for, but also you can see mobility. If you see mobility, this is indicative of later stages of the disease. Mobility can be caused from other things, including implant fractures. So it's not always the only component you're looking for, but it can be there when it's later in the stage of peri-implantitis. The implant needs to be removed if it's mobile, and it needs to be removed if therapeutic treatment is not able to remove the inflammation or they're not able to attain the healthy peri-implant tissues. There is some more risk factors for implant failure. Some of those indicate that history of periodontal disease, poor oral self-care, or irregular professional maintenance visits, a history of smoking or current smoker. If there's residual cement left around the implant, this can have bacteria that will latch on to those areas, as well as biomechanical overload, which is too much occlusal pressure placed on the implant, which could be due to the position or placement of the implant, the number of implants supporting a prosthesis, so like a fixed bridge or denture, and then the distribution of the occlusal forces on the implant. So if it's too much pressure, it can cause implant failure. So lastly, we're going to talk about some last key considerations for dental hygienists. So surgeons are the ones that place the implants, but us as dental hygienists are the ones that need to keep them safe, keep them happy, keep them alive. We want to make sure that we're aware that the natural immune system does not work the same with these dental implants, and they're more highly sensitive to bacteria. We want to make sure the objective of us maintaining peri-implant health and managing disease is to create an environment that's both manageable for the patient and the clinician. This is achieved by reduced probing depths, eliminating bleeding on probings, pus or suppuration, and halting any progression of bone loss. Implants should be removed if they have failed. That you can't keep them in if they're past the point of no return. It's very important that we check every implant at every maintenance appointment for signs of peri-implant disease.
And for the safe cleaning, there are some safe cleaning rules for the hygienist. And first one is use light probing pressure. We have to use a plastic or titanium or graphite probe push with an light touch so you don't not to tear or then hurt the skin. And we should never use a metal scaler because the metal can scratch the implant and create a perfect hiding place for the bacteria. And use only a special titanium or plastic coated scaler. And custom home cleaning, we have to teach the client how to use the nylon coated interdental brushes, tufted floss or water flosser to clean the under their new uh, or new implant or tooth safety. And in summary, implant surgery involves the careful planning, precise placements, and proper healing. Following post-operative instruction is essential for successful implant treatment and long-term health. Thank you.
Thank you. Thank you for listening to our presentation by Tara and Courtney.
Thank you.